Schizophrenia is a severe mental illness, and persons with schizophrenia often lose touch with reality, and this affects how they think, how they behave, and how they relate with others. Schizophrenia usually presents in late adolescence, but it can be earlier in some people and can affect both males and females. Schizophrenia affects people all over the world, including Ghana. Just like other mental illnesses, there's no single cause of schizophrenia. However, a number of factors are suspected to increase the risk of a person presenting with the signs and symptoms of schizophrenia. These may include genetic factors, and in this, persons who have family history of schizophrenia are at an increased risk of also developing or presenting with schizophrenia. Environmental factors, such as persons using substances like cannabis, may increase their risk of also developing schizophrenia. Also, certain stresses in life may precipitate the symptoms and signs of schizophrenia and in persons who are at risk of developing schizophrenia. There are various presentations of schizophrenia, and the symptoms and signs may differ from one person to the other. Some of the commonest signs and symptoms we see are, first of all, persons holding on to beliefs that may not be true. For example, the person may believe that people may be out there to harm them or people may be poisoning their food, which in actual fact may not be the case and may not have any evidence to support this. Other persons may also start having experiences that are unusual. For example, they may start hearing voices of people who may not be around or may start seeing things that other people don't see. Neglect of a person's personal hygiene may be seen in some cases of schizophrenia. In some presentations of schizophrenia, the person becomes withdrawn from society and have no zeal or drive to engage in activities or other purposeful activities. This presentation in particular may be similar to the presentation of other mental illnesses like depression, and special attention should be paid to this particular presentation as well. Schizophrenia can be managed, and there are various options available for the management. An integral aspect or important aspect of the management is medications. Medications are available to help treat the signs and symptoms of this condition. In addition to the medication, persons with schizophrenia may need talk therapy, and this may also be helpful in their recovery process. They would also need the support from the family and the society to help them live through this condition. Schizophrenia is a chronic illness, just like hypertension and diabetes. And so persons with schizophrenia may need to be on their medications for a long time to prevent the symptoms from coming back again. And it's important that treatment is started early, as it's known that with early treatment, outcomes are usually better. Schizophrenia is a chronic illness and is likely to worsen without treatment. Persons with schizophrenia who don't get treated are likely to see a worsening of their condition and may actually lose their ability to live independently. And all aspects of their lives are also going to be adversely affected by the condition. Discrimination and stigma are some of the major problems faced by persons with schizophrenia and other mental illnesses. As family and friends, one of our main mandates is to work towards eradicating stigma and discrimination against persons with schizophrenia. In addition, we are supposed to help them through their treatment. We may need to accompany them to the hospital to get their medications and needed care. We may need to check on them from time to time to see whether there's anything we can offer or any support we can offer them. We should also encourage them as it becomes difficult for them when they are diagnosed with the condition. A diagnosis of schizophrenia does not mean one will not be able to work, and it's not a death sentence. In fact, a number of persons with schizophrenia who are receiving or have received adequate treatment are currently able to work productively and engage in meaningful activities. Workplaces can support persons with schizophrenia by, first of all, not discriminating against them, but rather making them feel welcome and comfortable in the work environment. There may be the need for adjustment at the workplace to accommodate the person with schizophrenia. Schizophrenia is a severe mental illness and affects persons from all walks of life. It often presents in late adolescence, even though it may be earlier in some people. The symptoms and signs of schizophrenia varies from person to person and sometimes may be similar to other mental health conditions. There are available management options for persons with schizophrenia, and early treatment is key in improving outcomes in persons with schizophrenia. Family, friends, and workplaces can all support persons with schizophrenia by providing them the needed support and care and not discriminating or stigmatizing them in these environments. Thank you.